Ready? Yep. Ready? 28 ready? You guys ready? Let it rip. Good morning, Mayor, Council, Deputy Mayors. This is a little non-traditional event we're having today. We're referring to as a virtual town hall. It's being posted on Channel 28. It's also on Facebook Live. It's non-traditional in the sense that it's very important for us to keep social distance as a community, but also to keep gatherings low to stop the spread of this virus. The community can participate in a couple of different ways. One is we have people looking through the Facebook Live story to filter questions that may be pertinent to everybody in the community. As well as we're taking emails to Andrea, who's our city clerk, and she'll be filtering those as well. Those will be coming in after the presentation. Just a brief update on what city staff has been doing. We have opened the EOC and are fully operational as an EOC, working on projects and programs to help mitigate some of the challenges that we're facing as a community. With this, at this point, I'm going to turn it over to Rex Paris, our mayor, Rex Paris, to communicate and talk about what we're doing and some messages we're going to be sending.
Jason, before you do that, for the people at home, can you tell them what EOC means?
Yes, thank you. The EOC stands for Emergency Operations Center. It's a standardized process in which cities or all governments use in an effort to communicate and implement an emergency operation. The benefit of that system is that it's consistent nationwide. So when we communicate up to the county level, the county OES, which is the Office of Emergency Services, there's a consistent message and a consistent theme of the way we operate. When they communicate to the state, there's a consistent theme in the way the state operates and manages its emergencies, and the federal government as well. So in this process, once we establish the EOC, we create a direct line of communication with those other agencies that deliver services that are beyond what we can do.
Jason, why don't you introduce our guests before we start?
Today we have, obviously, the City Council present. We have Dr. Trong, who's the infectious disease specialist with Kaiser in the hospital, and we have Dr. Stock, who's the director of the emergency services at the AV hospital. They are also deputy mayors appointed by our mayor.
Thank you. The purpose of today's town hall and everything we do for the next 3 months is going to do whatever's necessary so that no one in the city of Lancaster dies needlessly from this disease. As stark as that sounds, that's really what we're doing. There is no reason anyone needs to die from this if we do everything right. We are also concerned about businesses going out of business because of this. We do not think there's any reason why that has to happen if we all work together in regards to solving this crisis as long as it lasts. And the purpose of the day is to tell you a little bit about how we intend to do that. We will be declaring, we are declaring, as of now, a state of emergency in the city of Lancaster. Now, you've been hearing that from various different government agencies. It seems to mean different things depending on who's saying it. Let me tell you what it means here. It means we will take whatever authority we need to take to guarantee that the people living in Lancaster do not die needlessly. What's needlessly? That means anybody dying from COVID-19. There is no reason why that has to happen. But we do have to be restrictive in many ways that we're not comfortable being. And I also want to be very clear about this. Do we know what we're doing? No. We have never done this before. This has never faced any of us. It's been 100 years since the United States has faced an emergent situation this severe, and that was the Spanish flu in 1916. I'm incredibly encouraged by what I'm seeing coming out of Washington and from our president. Regardless of your feelings about the president, he has never been this presidential. He is taking decisive action that is guaranteed to help the American public get through this. We have a whole team in the city working with Washington to make certain that as funds become available, we can transfer to businesses in the city of Lancaster. We are now researching whether or not we can compel employers to continue paying salaries if they close down during this crisis. We don't know the answer to that. We should know by the end of the day. The reason we would do that is because it's much easier to get federal money for the employer and then not have to worry about the 100 employees because he's already paid them. Not the best circumstances, but that is what we're looking for. We want to ensure that the families in Lancaster have as little disruption as possible. For those amongst us who like to complain and criticize everybody when they're watching from afar, please don't call me up and criticize anything until you're able to tell me that you actually went to the store for somebody over 65 and delivered groceries to them, that you actually took care of some of the children that are now without parental supervision because the schools have closed. Do not call and complain until you're able to tell us what specific action you've taken to help your neighbors, because that is what it's going to take for us to get through this with as little scars as possible. We have to help each other. We have to love each other. The whole concept of this being a Christian community is now being called into action. We either love our neighbor or we don't. We either take care of them or we don't. Now is the time for you to take action at home. Now, I think I've sufficiently gone off my notes and have staff sufficiently concerned that I'll go back to what the notes say. As of yesterday, there were 94 confirmed cases in Los Angeles County. What does that mean? That means if we do nothing, they will double every 2 days. Just sit down for a moment and do the math. By the end of the month, everybody's infected. That is why we're taking such draconian measures now. We have to slow this down, and we will. Los Angeles County Public Health has issued directives closing the gyms, closing the restaurants. You can get food to go, but you cannot go in the restaurant and sit down. What else did they close?
Bowling alleys. Public establishments where people can.
Visiting for hospital.
I guess the easiest way to answer that question is if you're within 6 feet of somebody, they closed it.
Hospital visits, I believe so.
No hospital visits. No group home visits. The whole idea is to limit contagion for the next 2 weeks. Yes, it's uncomfortable. Yes, nobody wants to do it. But we don't have a lot of choices here. We will either do it or people will die needlessly. This is not an exercise. This is the time everybody needs to step up. That being said, the city is going to take additional precautionary steps to limit the number of cases that will occur. There will be an emergency virtual council meeting tonight at 5 p.m. The resolutions we intend to pass include, but are not limited to, the following items. Now, what does that mean? That means, no, you can't come to the council meeting tonight if you're a regular attender, because it would be more than 10 people meeting if you did. Everything is going to be done virtually, at least for the next 2 weeks.
Can you explain that the governor suspended the Brown Act?
It's been suggested that I explain to you that the governor suspended the Brown Act, but I also recognize that 99% of the people don't know what the Brown Act is. But for those of you who pay attention to that sort of thing, it's been suspended. That means meetings do not have to be public. The resolutions we intend to pass include, but are not limited to, the following items. We proclaim the state of emergency, confirming the emergency regulations for public meetings to mitigate the transmission of COVID-19, extending deadlines for non-essential city functions. That means if there's a deadline for you to pay your license, business license, something of that, it's suspended for the next 90 days. Limit in-person meetings. No meetings with more than 10 people across the board. If you walk into a meeting and there's 10 people there, you are breaking the law. More importantly, you are endangering your families. All sporting events are canceled. Limited access to group homes, senior center, independent living centers, and hospitals. So let's talk about that for a minute. Our loved ones who are in extended care or the hospital or even in a group home This is very difficult for them. They're essentially being put in prison. Now, it's a nicer prison than what we see on television, but they are still confined. They are still limited in who they can see and talk to. Now's the time to use your social media, use your FaceTime, at the very least, use your phone. Call these people you love once a day. They are going to suffer from extreme loneliness as the time goes on. Do what you can to help them. We are demanding that grocery stores set aside times for senior citizens to be able to shop. Anybody over 60 should limit any exposure as much as possible. We do not want them standing in line at the grocery store. So we've requested, and we are now, by ordinance tonight, making it mandatory that that time be set aside. You know, there's some real heroes in all of this, and we tend not to recognize them. Your bus drivers, your people at the check stand, when you go to the store and check out your food. People that have a lot of contact with other people. They're still coming to work. They're still doing their job. They're heroes. Make no mistake. They are risking their lives. Nonetheless, they still go to work. They still deal with the public. Thank them when you see them. It is not a small thing they are doing. I also want to call out Vallarta Markets. They were the first ones that came in and said, 7 to 8? 7 to 8 seniors get in, no one else unless you're a senior citizen or have a disability or if you're pregnant. They were the first ones. They didn't hesitate. They are great citizens of this city, and we should remember this as this crisis goes on. Who's stepping up and who is not? There's a 90-day stay on the payment of any application fee, any business renewal, anything to do with the city. And we will pass an ordinance prohibiting landlords from evicting anybody during this time of crisis. Yes, I know that creates all kinds of problems. It creates a situation where people who could pay their rent might not. Nonetheless, this is not the time to be putting people out on the street, and we will prevent that from happening. If you're over 65, it is not just your own health that we're concerned about. If you get sick, you will consume enormous resources at the hospital. We have limited ICU beds. We have limited ventilators. We have, I guess the best way to say that is everything is limited. You not only owe it to yourself and your family, you owe it to your community to do whatever is necessary not to get sick. In a moment, I'm going to turn it over to the doctors here, and they know a lot more about this than I do, and they will be able to help you with that. But make no mistake, this is a time where it's a patriotic act not to get sick. It's also important that do not overburden the healthcare system. If you don't need a doctor, don't go. I think they actually call them regular attenders or something like that, people that are constantly going to the emergency room. Now is not the time to do that. If you go to the emergency room, understand you are walking into an area of infection. There's no good reason for you to be there unless you have to be there. We have, what do we think? We have about 10 employees now working on just getting federal subsidies and state subsidies into the hands of our citizens who need them. If you're experiencing financial difficulties because of this crisis, because of having to close the restaurant, call us. We should be able to help you within a day or two. We are working around the clock on making it so there's as little business disruption as possible. Also, if you have business disruption insurance and you've had to close because of this, file a claim. File a claim today, because there's going to be a line, there's going to be a queue. You want to get in there early. We encourage everyone to sign up for the email and the texts from the city. We will be sending them out as new developments occur. People have asked, do we have to follow the rules from LA County Public Health? The answer to that is yes. When they ordered the closing of restaurants except for takeout food, that is mandatory. However, and I want it very clear that this team is evaluating everything that comes out of the county. If we ever decide that our people are not being protected, we will appoint our own health officer, and I guess it's probably going to be one of you two. And that will enable us to take control. Right now, we see no reason to do that. I think I've covered it all. Who wants to start? The doctors.
Dr. Stock sees patients initially in the emergency room, and then he calls us and puts a patient upstairs. So I'll let Dr. Stock go first. Your initial evaluation of the patients.
Good morning. The hospital at Antelope Valley Hospital is starting to see an increased number of cases of people concerning for the COVID-19 virus. To date, we have not tested anyone who's been positive, but there are tests that are pending right now. Yesterday, we saw what appears to be the beginning of an inflection point, which is coinciding with the doubling of cases, as the mayor said, over the weekend. Case in LA County went from 30 to 70 and now over 90. So with this in mind, we need to really consider that we may be at the beginning of something very important. You've been given instructions in the media and from this council about how to keep yourself safe. That's the first line of defense, is within yourself and within your families, how to keep yourself healthy. The idea is to follow those basic messages, which is to wash your hands frequently, don't touch your face, stay away from sick people, keep social distancing of 6 feet, minimize your personal risks. After that, the idea is if you do get sick, the first thing is to consider calling your doctor, not going in to see the doctor. There's a lot of information and contact with medical providers through telemedicine now, through the phone, and it can reduce the risk by getting the information you need without actually coming in. The second line of defense would be going to see your doctor. And who should come to the hospital are people that feel short of breath, because if people get sicker, we want to take care of you. If you're not short of breath and don't feel it's an emergency, don't come. There's a lot of care that can be done. Most people will ride out this illness if they get it at home and be fine. But we do want to see those people that are sicker. We are starting to begin our testing through both public health and through the private sector lab testing. We've taken measures at the hospital to reorganize how we see people, to make sure that we minimize the risk both to patients and family members and to staff members. We are all wearing personal protective equipment continuously in order to do that, because it's very important to keep our healthcare workers safe in order to take care of you folks. If you come, you may be seen first by someone at a checkpoint at the front door, or if you come by ambulance at the back door, and we're vetting people so we can get you to the right place to get the right level of care and the right level of information for you. And we are gearing up for whatever happens. Thank you.
Thank you, Dr. Stark. When a patient's admitted to the hospital, we get on in terms of the hospitalist, infectious disease, and pulmonologist when we are concerned about COVID-19. We are seeing an increase in patients being admitted for a more moderate respiratory illness, but we're also seeing more over caution because a lot of the cases that I'm beginning to see it's because the clinician is more worried than he or she should be, given the environment. That said, we are seeing everyone, adjudicating everyone. One of our biggest concerns now is testing at both hospitals. LA County Department of Public Health is overwhelmed. They cannot help us very much. In fact, when we call on them for advice, really, they really can't help. It takes about 5 days now to get the results back. So now patients are backing up in the hospitals, and we're very concerned about throughput for us. At Palmdale, it's 5 days. At AV Hospital, 5 to 7 days, and that's our biggest bottleneck right now. As of yesterday, like the mayor said, 94 cases confirmed in LA County. We heard of one case in Lancaster, but it is not in any of our hospitals. It is not at AV Hospital, it is not at Palmdale Regional, and it is not at our Kaiser facilities. So I believe it is someone that is not in our system that we know of immediately. Sometimes if you live in Lancaster and have a Lancaster zip code, but you're admitted elsewhere, for example, at Cedars-Sinai or someplace, it may bounce back to us as a positive, so we're not sure. I've reached out to my colleagues in infectious disease in the community, and they all said they have not seen or have been consulted on to see a COVID-19 patient. So that's the latest on that.
I want to add one more thing for our EMS colleagues and law enforcement colleagues. It's very important if you call for help that you be very upfront if you're concerned that you're sick. We need to protect all of our people that are out protecting us. So it goes for law enforcement, it goes for the fire department, it goes for the EMS agencies. If you call for an ambulance, don't be shy. Before they get anywhere near you, please tell them, I'm worried, I'm short of breath, I'm coughing, I have fever, so they can protect you and protect themselves. They're in close quarters with you, perhaps in the back of an ambulance, and we don't need our firemen and EMS providers getting ill. We need to keep them healthy so they can help the rest of us. So please communicate clearly as you can. Thank you.
Okay, I would like Ken Mann to talk to us a little bit about what's going on in the restaurants. Okay, go ahead.
Right. Thank you, Mayor. As the mayor has already stated, we're allowing the continued operation of restaurants with restricted service, those being of three types. One obviously would be for third-party takeout, the other one for pickup, and then the third one for drive-through. One of the things that the mayor passed on is this is where the time of vigilance with leadership in each one of the restaurants to make sure that we're constantly hand washing is taking place, the proper use of gloves. When somebody said, how did we get selected to be on restricted service? You have to realize that it's easily contacted through hand-to-food contact. So you might want to review your hand washing procedures with each one of your staff members. I would recommend that you reinforce that breaking of that cycle, meaning that you might want to set a time frame where you request the staff to constantly go and wash their hands, follow the hand washing procedures. And then lastly, we want to make sure everybody understands this is where we put the public at risk. And as the mayor has explained, we will make sure that we do whatever is necessary to keep the public safe. So if we find people seating people and using the dining room, obviously we will take whatever necessary actions. If necessary, if we need to close you, we'll have to close you. And then lastly, I'm going to recommend that you need to think in terms of filing that business interruption insurance. Probably the easiest way for us to get financial aid from the federal government is going to be through the insurance companies. And I would do as the mayor has already instructed, reach out to your insurance carrier and file that claim now and get in line, because ultimately we don't know how long this will last. And I would recommend that you take these emergency steps today. Thank you, Mayor.
And I'd like Marvin Chris to talk a little bit about public transportation and what precautions you should be taking in regards to that.
Well, first of all, I want to thank the bus drivers for staying there and doing their job. What we're looking at is taking our buses, and if there's a 50-person capacity, we're limiting that to 50% of it, which will be 25, and then we're giving more service to everybody. So there will be a continued bus service. The easiest thing for us to do would be to shut the buses down. But we have to protect the disadvantaged community also. We have to get them their medicine, their food, and all that. So that's the precautions that we're taking. We also hired additional people that will ride the buses, and those people riding the buses, after each individual leaves, will wash it down, will wash the bus, will wash the compartment down that the individual, and they're being sanitized deeply every evening. So we're doing everything that we can in the transportation area to make sure that they're sanitized and that the disadvantaged community can it. But we're stressing to everybody that if you can stay home, please stay home. Thank you.
When you think of all the national emergencies we faced and the incredible sacrifices people have had to make, we're asking you to sit on your couch. We can do that.
Mayor, we also have Battalion Chief Randy Perry to talk about the fire department operations, if he'll be up.
Mayor, thank you. City Council, thank you for having me here. I'm here on behalf of Thomas Sullivan, who unfortunately couldn't make it.
Hold on a second. I want to make sure you're on the camera.
Okay.
I don't think that that location is. Could you come to the front?
Sure, I'll come to the front.
It'll work.
Okay. Is this mic on, or do I need to just turn on? Okay. Thank you, Mayor. Thank you, City Council, for having us. I'm here on behalf of Fire Chief Thomas Sullivan, who unfortunately couldn't be here today. Just wanted to talk about what we're doing with the COVID-19 response. You know, the LA County Fire Department is Lancaster's fire department, and we serve with pride, and we want to do everything we can do in our power to help the public. One of the things that the mayor said and the doctor said is that we're really concerned about what type of 911 calls are coming in. So we really want to implore the public to really think about what you're calling for. If you've got a hurt knee, or if you just have flu-like symptoms, unless you're really having difficulty breathing, try to refrain from calling 911. Try to ask a neighbor, like the mayor said, this is their time to step up, and so we can all participate in this crisis. Try to get a neighbor to take you to an urgent care. Don't necessarily go to the emergency room. Try to go through the urgent care if you just have mild flu-like symptoms, or try to stay at home and tough it out. And there's stuff online that can help you with that, with ibuprofen and stuff to relieve your fever. But try to keep the 911 system available for emergencies that we need to get to. Some of the things that we've changed, our dispatch now has a little more intense tiered system, so we're asking a lot more questions, and they are those questions about do you have a fever, do you have a cough, headache. So with that information, if we do get a call like that, you're going to see our folks show up a little bit different. What they're going to be wearing, I brought some props here, they're going to have eye protection on, they're going to have a hospital gown, and they're going to have an N95 mask with the gloves that they normally wear. That's not normal for us. That's if you have flu-like symptoms, we're protecting our first responders, so they're there for you when you need them. One of the other things they're going to do is if you do have a cough or you are exhibiting flu-like symptoms, is they're going to come and it's no offense, but they're going to come and put a surgical mask or a paper mask on you as the patient. So that's something different. We're also not all going into the house or the apartment. One person's going to go in, evaluate you, and then ask somehow if you're able to come outside, get you outside out of that enclosed environment. That's just kind of some of the steps that we're doing. We are prepared for this. This is an evolving thing that we're trying to stay ahead of. I think that the collaboration between the city, the county, the doctors, the emergency room, and us, I think we'll get through this and know that we're there for you. Thank you.
Thank you.
Thank you, Mayor. From a staff perspective, we are complete. I just want to clarify that this is not a decision-making meeting. This is for informational purposes only. We will be having a council meeting at 5 tonight, where a lot of these decisions will be made. So just as a town hall forum, an opportunity to engage. We did select a few questions that came off of online, and we have those to the mayor, and we'll be happy to answer any questions that you may request.
Thank you. I want to ask the doctors. My wife came up with I thought was a tremendous idea. She took cortisol cream, just a little dab, put it all over her face. She said she didn't touch her face all day. And it sort of made sense to me because, we touch our face because of a stimulus, a sensory stimulus, and this would deaden that stimulus. What do you think?
I've never heard of that, but that's an interesting thought. If you really want to deaden the stimulus, usually lidocaine ointment, but that's more. But I think cortisol also reduces also can remove your keratin layer. So be careful with putting so much cortisol, especially the more potent ones, on your face.
I think maybe not a good idea.
Yeah, well,
right. There's some risk to steroids on the skin can thin the skin, and as Jonathan said, and however, I think it's a nifty mechanism that you thought of. I think the point I think that you're bringing up, which is true, is that we touch our faces more than we even realize. We probably normally touch our faces 50 times an hour, and to scratch our nose or whatever we're doing. You have to be incredibly disciplined and have situational awareness not to do that. I spent time in Liberia during the Ebola crisis, and it was absolutely essential that you didn't touch your face because you could die. So in this case, we're giving similar types of messages, although Ebola has a much higher death rate than this does. The principles are the same. Wash your hands frequently. Avoid touching your face. And be aware that you may reach to do it. You can stop yourself. So thank you.
Good, thank you. Have you ever wondered why when people come from a different country, the children very quickly speak unaccented English, but the adults continue to have an accent the rest of their life? Well, we know why that's the case. The reason is because we'll tell children how to pronounce a word. We correct them. And our social structure is we do not do that with adults. The reason I'm telling you this story is because start telling each other. I just scratched my nose and Marvin laughed at me. That's his way of telling me, stop touching your face. Tell each other. This is critically important. You will not get this if you wash your hands and don't touch your face. I mean, but it's easier said than done. We're getting lots of questions coming in, so I think I'll pass them around as we go. Can you ask questions? Yeah, go ahead. What do you got?
Can the deputy mayors please explain to us the actual statistics, the reason why this is more lethal than an ordinary flu, what the percentages are? Try to comfort the people at home, because with the invent of the internet, we have far more homegrown doctors, and they're telling everybody the total opposite of what we're finding to be true. So can you explain to us the percentages, the whys, how ordinary flu is taken care of, and why this is different?
So the coronavirus has been around all this time, and it usually causes the common cold. 25 to 50% of the time it causes the common cold. At any one time, 50% of Americans get it annually, and you can get it 3 to 4 times a year. We don't have immunity to it, so that's why we keep getting the infection. Over time, though, this coronavirus has evolved and has become more lethal. And not only does it infect the nose, the mouth, and throat, now it goes after the lungs. So it attacks certain particular alveolar cells in the lung and causes the severe illness and death. the mortality is higher than influenza. Influenza in a bad year, the highest we've seen is 0.8% mortality. This one is at least out of China and Italy and other countries. It's quoting at between 2 to 3% mortality. So it is more, 3 times to 4 times more than influenza. In Korea, though, the mortality is less, simply because they're able to test more. So when you test more, you have a larger denominator. So in Korea, the mortality rate is closer to the influenza, 0.9. It's still higher than a severe flu season. What we are seeing also, at least out of a large study out of China, 72,134 patients confirmed, is that the mortality rate is very similar to influenza in people below 50. So below 50, it's 0.3 mortality. Once you reach 60 years old or above 60 is 3%, above 70 is 12%, above 80 is 14%. So the data skews against the older population. Out of Italy, 90% of deaths are patients above 70, 80 years old. And Italy is going through a bad crisis. So in terms of lethality, this is a new virus. And why are we as worried if it's influenza? With influenza, we have easy diagnosis. It's a swab in the emergency room. We have a vaccine that works 60% of the time. And we have medications against influenza, both oral and IV. So we're not very worried. With this coronavirus, we don't have a vaccine. We don't have a test that's easy to do that has a quick turnaround. And we don't have treatment. So that's why it's a lot more scarier than the influenza, a severe influenza season. I don't know if that answers your question.
The other end of that stick is how contagious it is. So
yes.
So for every person that gets it, 2 to 4 other people may also get it. So it's sort of a combination when you take that has a somewhat higher mortality rate. It's somewhat more contagious. And the third element that we didn't have during the 1916, 1918 period with the Spanish influenza is that the social networking we have and the travel that we have today didn't exist back then. So the fact that people travel around the world every day, or at least did at the beginning of this, and there was a nice article that shows that people at the nexus of social networks were more likely to have it and then spread it to their social networks. And if you had if you were out, let's say, in a place where you didn't interact with a lot of people, that you could, there was less of a chance of spread. So the way we move by transportation and by social networking is also a risk, and that is why social distancing is the intervention.
Daryl?
Yeah, I was recently talking with our vice mayor, and he stated that how we have the highest per capita of churches out in here, and many of us, a lot of the pastors have contacted me personally. A lot of them are not set up for video. The average church in America is 50, so we were okay in the beginning, but now with the 10 coming down from us this afternoon, a lot of them are concerned. And financially, there's another concern because while other entities may be able to get government funds, churches may not. So we're trying to see, is there anything that we can do, number one, to help the struggling churches that may still want to stream but may not have the capacity to do it? And is there any type of maybe financial help that can come for churches here in the city?
Let me give that to the city manager.
Yeah, great question. Thank you. We are working, and it should be open and operating today, a system not just for churches, for everybody who needs to reach out to the public and have either communication and or service or some other mechanism at Cedar Center. So it'll be able to be streamed, it'll be able to be recorded, and it'll be able to deliver to their parishioners. So that will be operational today, is our hope. So we're going to get that message out as it comes through. It's part of the business continuity program we're implementing, is trying to make sure that those folks have the opportunity to continue to communicate. So we're working on that right now, who don't have the technology available to them.
So they'll be able to make an appointment some type of way and say, hey, we would like this hour or half an hour to do this for our stream, and the city can help. Okay.
Absolutely, and share that with their parishioners.
Thank you. You know, it's difficult when your vice mayor is a comedian, too. Okay, there's lots of questions coming in regarding nail and hair salons. As of now, they're still open. We suggest that they be very careful in their hygiene and in their protocols. This is the time you wear the gloves, so to speak. And we're going to be checking. As Ken Mann said, we will enforce all of the health laws as if they're the most important laws we have, because they are. The homeless, a lot of questions about the homeless. Obviously, this is a very difficult situation in regards to caring for the homeless. Fortunately, you know, we've made a lot of progress. 40 to 50% of the homeless in Lancaster either have beds or very soon will have beds. That still leaves a significant number of people, quite frankly, out in the desert. And we are working on that. As soon as I have more answers, we will get them to you. There is some confusion about this rule about 10 people. It is groups of 10 coming together. Yes, we understand there's going to be more than 10 people in the stores. There are more than 10 people on production lines. But what we're talking about is the unnecessary grouping of people in any type of meetings that are not essential. You know, we now have the technology. There's really no reason for any meetings that we don't do virtually. But is that an exposure? Of course it is. You know, what we're doing now is we're minimizing risks. We're not eliminating risks. Are we going to postpone the election? Well, you know, if it was up to us, we wouldn't have an election. But I understand some people might object to that. Coincidentally, this particular city election is vote by mail only, so there's no reason to change it. There's no reason it should be affected. We would suggest that you fill out your ballot and mail it in. It's somewhat of an experiment. Is this a better way to do it? But this particular election, you have to get your city ballot in by April 14th. Are there enough testing kits? No, there's not. Let's not mince words about that. I'm sure that if we were in a perfect world, everybody you wanted to test, the doctors would be able to test. They're not able to do that. They are working on that and getting test kits to us. I was extremely impressed watching the president's press conference yesterday in that they have a vaccine in phase 1 trials. That is remarkably fast. That is cutting all of the bureaucracy and putting it in phase 1 trials, which will tell us if it's toxic. After phase 1 trials, it could start actually become available under the current laws. I don't know that it will, because it also requires the company that produces it to make it available. You know, family daycare is a problem. It's a problem across the board. A lot of daycare centers are shutting down. Schools have shut down. But this is really what I'm talking about, is when neighbors stand up for each other. If you know a single mother with 4 kids or 2 kids, and, you know, I mean, imagine how the quandary she's in. All of a sudden, the kids have been sent home. She has a job. Does she keep her job? Does she take care of the kids? If we come together now, if we check with each other, is there something I can do for you? Now's the time to help with those child care issues throughout the neighborhood, unless you're over 60. If you're over 60, don't be taking on those responsibilities. For the next 14 days, we want you to stay home. That is the best thing you can do for your community, is stay home. You notice how I just wet my fingertips? I mean, that's the worst thing I could do. Are Are we going to order a shelter in place? Probably not. And the reason for that is I think it's impossible to enforce, and we're not going to be ordering things we can't enforce. When it comes to enforcement, though, I want to be very clear with this. Now is not the time to be a jerk. If you run into first responders, either fire or sheriff, do what you're told. Be respectful. Those guys are out there all the time dealing with people that may or may not be sick. They are taking enormous risks. People's patients are being frayed. Don't you be the guy in the line at the store that starts yelling at the clerk. If you feel that you have to do that, leave the line and take a walk. How big of a jerk you are right now says more about you than you can imagine. So we have a new rule. I just came up with it. We're going to enforce it. No jerks. It's the no jerk rule. I really hope that within our city, we set the example for the nation. This is how a city comes together and helps each other. I don't want to see churches going broke. So if you're a tither, continue to tithe. They are under incredible pressures right now. Their entire way of funding the church has been disrupted. Within the city, we're trying to figure out a way to do bridge loans and how to use the federal government to help us with that. But like I said, we're not totally prepared in regards to those issues. But we do have people working almost around the clock on it. I'm not letting anybody work around the clock because if you're not sleeping, you are much more likely to get sick. There's a individual question is why did the hospital turn away a sick child at 103.2 fever? And I know just who to ask for that one if that occurred.
Yeah. So nobody's ever turned away from a hospital. Okay? We not only would that be the wrong thing to do ethically, but it's against the law. So anybody who shows up will be seen and will be evaluated. Some people come and choose to leave against advice or leave without being seen, and that does happen, unfortunately. But no one is ever turned away. That being said, we're trying to give common sense advice to people about self-care, about calling and getting information, calling your doctor, and finding other ways to handle more minor problems. But if you're sick and you're having difficulty breathing, we want you to come if you think you are having an emergency.
Thank you. Yes, Raj.
It's in regards of restaurants. So I know we're going to close the dine-in, but somebody asked me if we need to short the hours, or are we going to continue the regular hours?
Let me share with you best practices that's been shared within the industry. Most restaurants are operating either on a 7 a.m. to a 10 p.m. With those restricted hours. So that's what's been suggested so far. Not that necessarily is that law, but.
And then I still, like last night I saw the taco truck was on 30th and L. So are we doing anything about that, those especially for taco trucks?
Those trucks are actually, a preferred method of distributing food because they're not sitting down and sharing contagions. The thing I want to reiterate is we are sending out code enforcement people to inspect restaurants because all of those rules regarding healthy practices are going to be enforced. So if you run a restaurant, step back, make certain that you're complying with all those rules. It's essential at this time.
Yes, can I, to the deputy mayors, there's a lot of misconception about what type of masks to wear. Should we wear masks? Shouldn't we wear masks? Could you guys kind of elaborate on that? And what do you think is best practices right now for masks?
So at the beginning of the outbreak, the CDC recommended that to prevent infection, you should wear an N95 mask, especially for care providers. But as time goes on, the WHO had already recommended that droplet precaution was enough. You didn't need to be airborne precaution. So as resources are dwindling, the CDC made a change and allowed us to use standard surgical masks to evaluate patients who are possible COVID-19. But in cases where we generate aerosolization during our evaluation, for example, giving a patient a nebulizer treatment, intubate them, or do bronchoscopy, it's recommended that we wear an N95 mask in the full gear instead. So if you're coughing, please reduce your viral burden to others by wearing a mask, and that helps a lot.
Just to add to that, there's a misconception that for the general public, if you're not coughing, you're not sick, you don't need to wear a mask. And in fact, there's a limitation on the number of masks in the country and on the planet. So like a lot of resources, we need to try and distribute them to the highest priority areas. So if you are wearing a mask to try and protect yourself and you're not sick, that may not be the best use of that mask.
If you're sick and have to wear a mask, why aren't you at home? Sick people have to stay at home, for what it's worth. That mask is not a license for you to go out into public, is what I'm attempting to convey there. The next question is, are entertainment venues with only a handful of people at any one time allowed to stay open? No, they're not. Is Kensington at full capacity? No, it's not completed yet. We're rushing it through. We're trying to get it completed. And Kensington will be able to take about 40% of the homeless population off the street. They have taken quite a bit already, but it's a work in progress. As dire as all this sounds, we're actually in an incredibly good position in a lot of ways. I can't tell you how. It's just fantastic that Catherine Barger is the chair of the Board of Supervisors. She's our Board of Supervisor, our supervisor, and her office is incredibly easy and to work with, and it's sort of like coming together because of that. This is something we're going to get through, and we're going to get through with the least amount of distress of anybody out there, because we're going to be on it every second of the day, making certain that we maintain flexibility and that we are able to help wherever we can. But again, how well the individual neighborhood does is going to be determined by how well the people are communicating with each other and helping each other. Really, now is the time to figure out what it means to be a great neighbor and be that person. Let's see. Question is, are we working with Palmdale? Yes, we are. We're communicating. The city managers stay in constant contact with each other. But we are not cohesive in how the ordinances are being enforced. It is the position of your city council in Lancaster that we have hired our own people. We've got our own volunteers. We've got our deputy mayors. And we are relying on them. If the final decisions will be made in the city of Lancaster by the city of Lancaster. I may have already answered this, but lots of questions regarding sheltering in place and whether or not we're enforcing that. No, we're not enforcing it. But if you're over 65 and you're out in public, I hope somebody sneers at you, because you shouldn't be. The place is set up to give out food. Yes, they are regulated. They will be inspected. And, it's very difficult for people right now that are in the food service industry, because they're having to totally change their business model, and they have to change it overnight. So be patient with them. But at the same time, it's incumbent upon us to continue buying from them. Otherwise, well, it's obvious what would happen. The Emergency Operations Center, we have people in there working on getting more test kits to the Antelope Valley. The truth of it is we're going to have to wait our turn. They're making them at maximum capacity. I anticipate that in about 2 weeks that problem will be resolved. Wouldn't you agree? Okay, good. This is for the doctors. There's some articles suggest common meds like ibuprofen can aggravate COVID-19. Care to comment?
I read about that. We're really not sure. A lot of it's common sense to reduce your fever with either ibuprofen or acetaminophen, which is the Tylenol, but we're still not sure. That's the case.
So what do you suggest? Continue to take it?
If there's a question with ibuprofen products, perhaps we could switch to acetaminophen, which is a Tylenol, to reduce your fever.
Okay.
For now, yeah.
Okay, good. Thank you. Is City Hall closed? No, we are not closing City Hall. That will be the last step. I think it's important that the center of government stay open, and we will take whatever precautions to make that as safe as possible. If you come in, you may see people wearing plastic face masks. We are going to protect our employees to the best of our ability, but we will remain open to service the needs of the city. Churches are making their own decision about closing, but they are not having services. It would be, in fact, a crime for them to have services for the next 14 days. That's all I got. Do we got any more?
Mayor, I'd like to speak to just some common sense things. Many of you may feel that you're mildly sick. You may feel like you have a cold. And if some of you come to the hospital with mild symptoms, we're giving out information to those people about what to do when they go home. I'd like to give that information to everybody so you're prepared what to do if you get symptoms, you're not short of breath, but you feel well. The reasons to come to the hospital, I'll start with that. Shortness of breath, if you can't keep down fluids, if you feel dehydrated and can't drink, you feel confused or someone thinks you're confused, or you think you have some other serious symptoms. If you're only mildly sick and you're staying home, you want to protect other people. So stay home when you're sick, separate yourself from other people and animals in your home. So pick one side of the house, especially if you have somebody in your home who's got a serious medical problem, someone who's, let's say, in your family who might be on chemotherapy because they have cancer, somebody who's on special medicines because of an illness from a transplant, or they may have some compromised immunity, or you have somebody who's older in your house, somebody over the age of 60 is at high risk. Keep them on one side of the house and you on the other side of the house. Cover your coughs and sneezes. Avoid sharing personal household items. Clean your hands often. And clean all high-touch surfaces every day. So those are some common sense things to do. And as the mayor said, get plenty of sleep, eat well, and take care of yourself.
Thank you. The last question is, how are we getting information out to the homeless? We're using the current agencies that are helping the homeless for that purpose, but we're going to have to do better than we are. But like I said, this is a work in progress. Hopefully by the end of the week, anybody that needs a bed will have one. Jason, any reason we can't do that?
I know the county, the city, and LASA have been working very closely to figure out ways to do that. There's as it relates to the same messages we're giving to the citizens, we're giving to the homeless. If you're shelter in place, if you're in your location that you're safe and everything else, don't move. But focusing on those vulnerable populations first is the priority, those that are 60 and over, and then making sure that obviously we don't spread and exacerbate the problem. But it is a balance that we're working on right now with the county and LASA.
Thank you. Again, I want to remind everybody that all discomfort ends. This will end. We anticipate that it should be over by August. Could be wrong, but we don't think so. We think this will be over by August. And I've directed the city staff to prepare for the celebration in August for celebrating how well we got through this. I also think that this is going to be one of those things that when we look back in time on, it will have made us a stronger, better community. But that's going to require us to work now in order to be able to say that when it's over. This is the time to love your neighbor. Figure out what you can do to help, and I think that the rewards are going to be greater than the detriment at the end. Thank you. We will give you periodic updates. Oh, and one last thing. All the other government agencies out there, do not tell me something that you want me to keep secret from the community. When you tell me, I will tell the community. The policy of this city is to share information the moment we have information. That's the way it's going to be. So don't tell me if you want to keep it a secret, because I won't. And that's what the citizens of Lancaster should expect. It will be absolutely transparent in how we deal with this crisis. Thank you. Work hard. We're going to need everybody working hard. Thank you.